far away. Earlier on in the pandemic, a number of African countries like South Africa, Ghana, Egypt, Nigeria, Tunisia, and Gabon, just to mention a few, were sending healthcare workers into the community to screen and test people for COVID-19. The result from this exercise showed that many people had already been exposed to the virus. Neither did they know nor show any symptoms. This testing strategy worked well for many countries as many cases were identified early enough and people were able to self-isolate. And now, with many countries changing their testing strategy and only testing those who show symptoms similar to those of COVID-19, today we are asking you this question. We're asking you, how can Africa manage asymptomatic patients? Again, how can Africa manage asymptomatic patients? Make sure that you continue sending in your comments and questions on the BBC News Africa Facebook page. Also, a huge thank you to those joining us through our partner stations, Times Television and Capital FM in Malawi, NBS Television in Uganda, Bush Radio in South Africa, Splash FM in Nigeria, YFM in Ghana, QTV in Gambia, and of course, Sky Communications in Liberia. Let's take a look at some of those comments that are trickling in answering this question. Leave the unknown to God. Absolutely true. We really are facing the situation for the first time in the world. And here, Getatru Biriu from Addis says, what is the fate of the untested? That is a great question, and we'll definitely be posing this question to the experts who will be joining us later on in the program. And here, Joachim from France says, Africa has been ready thanks to the self-medication like concoction. That's a lot of speculation there on why exactly we're seeing lower numbers of COVID-19 cases in Africa. Could it be how we manage these symptoms? And Kwabena from Accra, Ghana says, asymptomatics are recovering themselves. No need to worry. Well, it is true that asymptomatic cases are recovering quicker, but the question is, what about them spreading it to others who are not infected? And definitely we'll hear from our experts. So to help us understand how Africa can manage asymptomatic cases, we're joined by Professor Nana Kofi Kweche, a public health Hello and welcome to this discussion from BBC Africa. My name is Maya Hayakawa. As global COVID-19 cases continue to decline, experts are wondering how some communities will be reached, especially those living in areas where laboratories with the capacity to test for COVID-19 are far away. Earlier on in the pandemic, a number of African countries like South Africa, Ghana, Egypt, Nigeria, Tunisia, and Gabon, just to mention a few, were sending healthcare workers into the community to screen and test people for COVID-19. The result from this exercise showed that many people had already been exposed to the virus. Neither did they know nor show any symptoms. This testing strategy worked well for many countries as many cases were identified early enough and people were able to self-isolate. And now, with many countries changing their testing strategy and only testing those who show symptoms similar to those of COVID-19, today we are asking you this question. We're asking you, how can Africa manage asymptomatic patients? Again, how can Africa manage asymptomatic patients? Make sure that you continue sending in your comments and questions on the BBC News Africa Facebook page. And also a huge thank you to those joining us through our partner stations, Times Television and Capital FM in Malawi, NBS Television in Uganda, Bush Radio in South Africa, Splash FM in Nigeria, YFM in Ghana, QTV in Gambia, and of course, Sky Communications in Liberia. Let's take a look at some of those comments that are trickling in answering this question. Daniel Ajare here, thanks for joining us. You say, we live in the unknown. We leave, rather, the unknown to God. Absolutely true. We really are facing the situation for the first time in the world. And here, Getachew Biriu from Addis says, what is the fate of the untested? That is a great question, and we'll definitely be posing this question to the experts who will be joining us later on in the program. And here, Joachim from France says, Africa has been ready thanks to the self-medication like concoction. That's a lot of speculation there on why exactly we're seeing lower numbers of COVID-19 cases in Africa. Could it be how we manage these symptoms? And Kwabena from Accra, Ghana says, asymptomatics are recovering themselves. No need to worry. Well, it is true that asymptomatic cases are recovering quicker, but the question is, what about them spreading it to others who are not infected? And definitely we'll hear from our experts. So to help us understand how Africa can manage asymptomatic cases, we're joined by Professor Nana Kofi Kweche, a public health expert at New York University based in Accra, Ghana, and Dr. Catherine Lepoto, the Deputy CEO, Co-operations National COVID-19 Secretariat in Lesotho. Right then, so let's get this show started. But before we engage our experts, BBC Sally Boyani breaks down different terminologies associated with COVID-19 and the probability of someone spreading the disease.
Infected but feeling fine? This is actually a common statement among COVID-19 asymptomatic patients. So I'm going to try to debunk asymptomatic infections in under 90 seconds. An asymptomatic laboratory confirmed case is a person infected with COVID-19 who does not develop symptoms. Often, people tend to confuse between asymptomatic and pre-symptomatic. Pre-symptomatic is when a person does not show symptoms but develop them in the early stages of an illness. But how can an asymptomatic person spread coronavirus if they're not coughing or sneezing? Studies indicate that this leaves direct or indirect contact modes and aerosol transmission as the main possible means. So how does this affect the spread of the virus? Now, we do not have cast-to-stone data on asymptomatic infections, but the Africa CDC Director John Kingasong said estimating the true number of cases in the continent is very tricky, but about 70% of infections are actually asymptomatic. Is this a good thing? No. This is because a lot of these people don't know they're infected, so they fail to take necessary precautions and end up being silent spreaders, which is very dangerous in a pandemic. This is especially tricky for some African states where the larger percentage of infections are asymptomatic. In Kenya, for example, a report dated 5th August shows that 93% of cases were asymptomatic. And in July, 50 to 60% of adult cases in South Africa were also asymptomatic. Because of the surge in numbers of asymptomatic cases, some countries like Kenya and Angola have opted for home-based care programs. To beat the virus, treat yourself as if you already have the virus. Isolate if you can, social distance, and wear your mask.
We're glad you're watching. The question we've been asking you guys is how Africa can manage asymptomatic cases. And I just want to take a look at some of the comments that are coming in right now. Bonnie Mutai here says, who is an asymptomatic patient? That's a great question. I do hope that you caught the VT that we just played right now, the video by Sally that explained what asymptomatic cases are. And Barbara here says, that's crazy when 40 to 45% of asymptomatic people are contributing to transmission. This is when I engage our experts. Let me start with you, Nana. Should Africa be worried about asymptomatic cases?
I think when it comes to effective epidemic control, you always want to make sure that you have an eye on all people who are infected. The reason why we're doing the testing is not just to do diagnostics, it's also to do surveillance. And in skipping out on testing asymptomatic people, there's always the risk that you are going to end up having large numbers who are skipped who can still pass on the virus. So if you're doing contact tracing and you don't have that pool of people in your index cases, then the scope and coverage and effectiveness of that contact tracing effort naturally is going to be somewhat compromised. For people who are asymptomatic themselves, there's also a question about long-term consequences of COVID-19. It's useful to know if you've had the virus at some point because we are still learning about what the long-term consequences really mean. We know that there are people who have mild cases, sometimes even asymptomatic, and go on to have, difficulties post the viral recovery, where there might be difficulties with breathing or fatigue. There's still emerging evidence about this. The continent has been very lucky, to be honest, to have had so many mild cases and so many asymptomatic cases. But it is important that we acknowledge those two things, that if we're not testing asymptomatic people, we can't do contact tracing for them. And that if we are not testing them, they don't know their status, so they don't know what to do with information that comes out about long-term consequences of COVID-19 infection.
Dr. Catherine, your country was one of those countries that recorded COVID-19 cases rather late as compared to other African countries. Could have the asymptomatic cases perhaps played a role in that?
Absolutely, Maya. Lesotho was the last country on the continent to report a COVID-19 case. And in terms of our response to the pandemic on the national level, we use that very fact that we were last as our comparative advantage. So the reason we say this is that because we came last, we know a lot more about how this disease is spread, how we can manage it effectively, and more than other countries did. And our responsibility as a country is to not repeat any mistakes that others who came before us made. So to your point, yes, absolutely. Asymptomatic spreaders, based on the data from South Africa, we appreciate that there are a very significant way in which this virus can spread. And ideally, as Nana pointed out, the best case scenario would be that we should test as many people as possible. But we have also to be practical. Practical in the sense that we appreciate the limitations of resources that we have. These test kits are extremely expensive. They are very difficult to find. And for the case of Lesotho specifically, when this disease arrived here, we actually didn't even have the capacity to test in country. So we relied on sending test kit samples to South Africa for testing there. But since around early June, we were able to set up our own testing capacity in the country. However, given the limitations, once again, of resources, we are still unable to test everybody as we would like to. But having said that, what we have decided to implement as a national response strategy is, on the one hand, we are looking at rather going very hard and strong on prevention measures, because we appreciate that there is a lot of people who are going around who do have the virus but are asymptomatic. We appreciate that such people could contribute to the spread of the disease. We are implementing really rigorous measures of prevention. For instance, we have established, and we are trying very hard every day, our programs are around implementing behavioral change in our population so that people can practice the physical distancing. Wearing of masks is a very, very important aspect of what's happening in Lesotho. A lot of people do wear masks. We are changing the way we do things in general, whether it's around how we handle ourselves, whether social gatherings are being limited. In general, we think this is how we will respond effectively. We want to also implement through regulation, which is something that I know that other countries have not yet done, but regulation of how to do sanitization and disinfection of premises. We've decided that as a country, we are going to put this in law. So as recently as 2 weeks ago, our cabinet task force approved the mechanisms of disinfection of premises that we will use in the country, so that we don't end up using the wrong methods and the wrong disinfection or disinfectant, which can very well contribute towards the spread of the virus by particularly asymptomatic patients.
I like the approach that you're taking. You're saying that, listen, let's work on preventative measures so that we don't have to worry about these asymptomatic cases in the first place. Nana, listen to these comments coming in. Karen here says, it is not confirmed that asymptomatic patients spread the virus. And a similar sentiment here from Taiwo, who says, does asymptomatic virus, is it easily transferable? So there's this notion that asymptomatic cases are not spreaders of the virus, especially if you're not coughing or you're not sneezing. What do we know about asymptomatic cases and how easily the virus is spread through these patients?
Well, I think that's actually one of the points that it's really important to clarify with respect to how likely it is that an asymptomatic spreader, an asymptomatic person will pass on the virus. And to point out that's different from the question of how many or what proportion of the total virus of cases are from asymptomatic spread. Now, we know that obviously the primary mode by which this virus spreads is through coughing and sneezing, and droplet particles on surfaces and other things like that. And quite clearly, if someone isn't coughing or sneezing, they are less likely to be able to actually pass on the virus. The other side of that, though, is that there are a lot more people who are asymptomatic than there are who are symptomatic. And what that means is that by sheer virtue of the large numbers of them, even though they might be less likely to pass it on, they make up a bigger share. They make up a large share of the total, infection events. And that's to say, about 40%, if you look at the different studies we have available, around about 40% of all those infections come from asymptomatic spread. So they do contribute a large amount of infections. It's just, arguably less likely they'll pass it on because on an individual basis, because they're not sneezing or coughing. But we should be clear that asymptomatic spread is a real thing. It actually does occur, and it does make up a pretty large chunk of the total onward transmissions.
Right. We're glad you're watching. Keep sending those comments in. The question that we're asking you is, how can Africa best manage asymptomatic cases? And Tame here says, probably Africa can establish more testing centers and probably subsidize the cost for test so that many people can go in for the test. At the moment, most African countries have very few testing centers, and where they have, it is very expensive. And I think Dr. Catherine touched on that when she spoke about the limited resources that we have in Africa and how we can make use of these limited resources. Keep sending in those comments, and if you have any questions for the experts, tell us where you're watching us from, and we'll definitely get those questions answered. But Dr. Catherine, your opinion, when we talk about 40% of these infections being asymptomatic, some countries are recording even as high as 70% of these infections. What is the best way to handle these cases?
Yes, so as I said earlier, being geographically located the way we are, we rather lean towards the South Africans' stats. So they are showing as much as 60% asymptomatic patients, right? So one should naturally just assume that because of the similar demographics and our location in, right in the heart of South Africa, if you will, we expect kind of similar numbers. So how do you manage them? Borrowing on the words of what Nana said earlier, it is important to appreciate that even though people who may be asymptomatic patients do not necessarily get sick in the here and now, we have to be concerned about identifying them so that they can have that the infection in their medical history, because you don't know what later on what the impact of having had that virus in one system could create later on. So absolutely, it is important that countries try and identify as many of these asymptomatic patients as possible, because we do not know what are the later repercussions that could come up. So every patient, in our view, every patient who has had this virus, it would be better that they know and their medical practitioners know rather than they do not know. However, given the limitations that we have on resources, our message in Lesotho is to say, let's keep as many people as possible from getting this virus in the first place until such a time that there can be an effective vaccine and effective treatment. So that's really what we are doing, because it is what we can afford. But when we talk about surveillance strategies as well as testing for surveillance, as Nana said earlier, we will now look at probably more affordable mechanisms of testing, such as antibody testing. But that is something that Lesotho will embark on once we have clarity on the effective antibody tests. Yeah, we are not just going to pick up anything that anybody throws at us and says, go and use it. Again, being last is a comparative advantage for Lesotho, and we are only going to implement methods, protocols, and technologies that have been proven to work. Thank you, Maya.
Right. Nana, as we look at how these COVID-19 infections are spreading across the continent and globally as well, the demographics are different. Africa, large largely a young population. What do we know about asymptomatic cases and what demographics they are affecting? Are we seeing this more in young people or older people?
Well, I think there's still a lot of work being done on that to understand exactly what those age dynamics are. What is quite clear, though, if you look at the circumstances in Europe and in the Americas, is that it does appear as though a lot of the spread that happened at the beginning of the pandemic and a lot of the spread that has happened over the summer in countries like France, Spain, coming out to the summer, appears to have come from young people who were likely infected, who were just going about their day without necessarily, adhering to all the protocols. So we know that there does seem to be a larger concentration of asymptomatic cases among those individuals, let's say under 40 generally. But again, there's a lot of work still being done on that to make that conclusive. What is clear, though, is that our population age structure has been a tremendous benefit to us. A lot of the severe morbidity and high mortality that we saw in Europe and in the Americas appears to come from, age-related conditions. So it's people who are already older, generally above 65 or 70, and who are living with other, underlying conditions, chronic diseases like diabetes, cardiovascular disease, and those things obviously exacerbate the consequences in addition to the age factor. We do have those non-communicable diseases among the African population as well. Mm-hmm. They are rising as a leading cause of death, but looking at the age structure components as well, in addition to that, it's quite clear that those dynamics that existed in Europe that precipitated those high mortality numbers just, aren't the same here, and that's been protective. But again, it is important that we acknowledge the fact that we still, again, do not know the long-term consequences. The problem with COVID-19 is not a binary one. It's not whether you live or die, because we know that increasingly we are learning more about COVID long haulers, people who are dealing with consequences months after they were first infected. And we need to adjust our expectations around that.
Right. Thank you for that. Great insights over there. If you're joining us just now, just to keep you up to speed, the question that we are asking you today is this. How can Africa manage asymptomatic patients? How can Africa manage asymptomatic patients? We're asking you this question based on the fact that 40% of the continent's cases are actually asymptomatic. So we're looking at how this actually affects the fight against COVID-19. How can Africa manage these cases? Send us comments on what's happening in your country and what you think regarding how we should actually tackle this issue. Now, the World Health Organization has said, despite Africa reporting a 14% decline of COVID-19 cases in the last 7 days, it's also worth noting that testing and contact tracing has also reduced. So, Dr. Catherine, it's still not clear whether we are at the peak of the continent's cases. Some people are speculating and saying that we are flattening the curve right now. With the changes in identifying these cases and also how we're tracing the contact, should African countries prepare for a second wave?
Absolutely, Maya. So I think, speaking for Lesotho again, so Lesotho has not even reached its first wave. And I think this is another thing that most of us need to always think about. We have to be cognizant of how the pandemic is unfolding in different countries, because it's not all following the same kind of scenario, right? So Lesotho, we are still at an R0 of about 1.2 in the last numbers that I saw, meaning that we are still climbing. We have not reached the peak of our first wave. Whereas South Africa, our neighboring partner, our neighboring country, is evidently seeing, a decline, that they have really reached the top of their peak, their first wave, and possibly things will increase later on. So I think it is important to also understand or remember one thing. So a lot of the countries on the continent went into hard lockdowns, yeah? So many, including Lesotho, have still maintained really stringent restrictions of movement of people, of economy. Yeah, so as we are seeing now, many countries are starting to ease down on these restrictions. Mm-hmm. South Africa has done that in the past several weeks. Lesotho is starting to do the same. So, for instance, we know that our schools are going to be resuming very soon in the next week or two. So we expect that whilst it is true that the last couple of weeks have seen a decline generally of the number of infections, but as the restrictions are eased and people start now resuming the normal, if I can call it pre-COVID way of life, despite all that we are doing to promote behavioral change and things differently, we expect that we will probably start seeing another, steep increase in the infection rate.
Dr.
Absolutely.
Catherine, sorry to step in. I just want to hear from you in terms of your strategy in identifying and testing. Are you going to rural areas? Are you doing mass testing? How are you going about testing?
Correct. So at the moment, we are following the strategy of other countries that have come before us. We are mainly focusing on symptomatic cases, but at the same time, we are doing a lot of work at community level to do screening. So all of our hospitals in the country are doing screening of any patient who comes into a health service center for any reason whatsoever. So they are doing basic screening for COVID-19. We are also starting to implement apps, technology that we're going to hopefully start to get to reach a lot more of the citizens and the population than we could before. Lesotho has a very difficult terrain, and perhaps this is actually one of the opportunities or the advantages that we have had, because the population is quite spread out in our villages, especially in the rural areas.
Right.
But at the same time, it is therefore important to start finding, better ways to reach these citizens as far and as quickly as we can. So yes, we have been primarily testing symptomatic people,
cases, yes.
But also we have been testing travelers, because this disease came into Lesotho primarily through travelers, most of them coming from South Africa, returnees, Lesotho citizens who work or live in South Africa who were coming home.
Right.
So we will continue to do so, within the limits of our resources once again. Absolutely.
Okay, taking a look at some of the comments here, the questions we're asking you today is, how can Africa manage the symptomatic cases? Becky here, you say, all we can do is wash hands regularly, keep distance where you can, and make sure you wear a mask if you are not able to keep distance. I love that you're giving tips on how we can stay safe. And here Tame says, in addition to continue faithful observance of the COVID-19 safety protocols by all will go a long way in addressing the subject under discussion, since testing and contact tracing is still difficult in our beloved continent. Thank you, Tamir, for that comment. Remember to tell us where you're watching us from. Charles here says, disregarding the asymptomatic means illnesses may eventually explode as asymptomatic patients pass on to the vulnerable over time. This policy of disregarding the asymptomatic cases well with some politicians or governments who don't want to regard COVID-19 as a dangerous disease, as they are willing to forget it altogether. But it is normal for new diseases to be disregarded as fake diseases, just like some governments try to deny that HIV causes AIDS. Now we hear allegations that Tanzanians are not very clear about COVID-19. When resources allow, let governments prevent infections through vaccination testing. That's a really long comment over there from Charles. And here, somewhere here, Kennedy says, what are some of the surveillance strategies in place to track those who still show symptoms after months of diagnosis? I think I'll throw this question out to you, Nana, because earlier on, you had mentioned that we're still learning how the virus moves, the long-term effects, and what this means for our continent's health in general. So what are some of the surveillance strategies in place right now to track those who still show symptoms after months of diagnosis?
Well, I think that's a country-by-country policy. I know here in Ghana, by virtue of the fact that we have done quite a considerable amount of testing, we've done tests on almost 500,000 people so far. And for the 47 to 50,000 cases that we are currently reporting, we know that all those identities are on record, so long-term follow-up is possible. As to what exactly is being done there, it's not so clear, but we know that those records exist at least. We know who the people are. Mm-hmm. There was initially in our discharge policy, there was a requirement for people to do 2 follow-up visits in order for medical professionals to assess how they're doing after they've gone through that 14-day period of isolation, after which theoretically their risk of passing on the virus is very low. So there was a two visit requirement in the aftermath of that. But again, it's not clear. You have to assume that that's happening, but there's not a lot of public information as to what that actually looks like. But it is important that countries try and develop these registries, because you want to make sure you know that if there are long-term consequences and therapeutics for those, that those can go to people who have them. And you want to make sure that you are monitoring, beyond the viral infection, because like I said, it is quite apparent that there are people who are recovering in terms of no longer having detectable virus in their systems, who are still experiencing consequences because of the damage to their respiratory systems, their cardiovascular systems.
Right.
And those are things that we need to invest time and effort in making sure I'm monitoring. That's one of the areas, to be frank. I think the COVID long hauler question hasn't been a very big part of our discussion in Africa. And I think a large part of that is because we've had so few, such a small share of symptomatic cases.
Nana, sorry to interrupt you, because I have about a minute left. So I just want to quickly ask you this question, because governments have closed schools. They're looking to reopen schools. We're seeing communities and economies open up gradually. Briefly, how should we go about testing now that we're looking at reopening our economies?
Well, we're dealing with a resource limitation. We're dealing with resource limitations around the continent. So the idea that we're going to be able to test everybody via PCR, which is the gold standard testing, is just not practical for the continent. But it does mean that we have to manage our risk activities to keep them within that sphere. We want to make sure, for example, that where we have residential facilities for education, like Ghana's boarding schools, that as much as possible, we're testing everybody who's coming into those institutions, the students and the staff, so that you can kind of have a de facto quarantine where you know that everybody within that bubble is generally COVID negative. That makes it possible for us to have a better sense of what the risks are and how to manage those.
Right.
We also want to make sure that we are doing all the other kinds of testing to keep the spread down, including antibody testing when it's possible and antigen testing when we can prove its efficacy.
All right, Dr. Catherine, in 20 seconds, tell me how you're going to be handling testing now that schools are looking to reopen soon. How are you going to go about it?
Right, so we're going to use the data that we have, especially around the demographics. We know that our population, the young population, is showing a lot more positivity than older populations. So we are going to start focusing on our tertiary institutions and implementing more testing in those areas.
Right. Thank you so much, Dr. Catherine and Nana, for joining this Facebook Live discussion. I do hope that that was helpful to you all. Remember that you and I both have a responsibility to ensure that we are staying safe. So remember the basics: sanitize, keep your distance, stay home if you feel like you have any symptoms of COVID-19. Well, thanks for watching, and I'll see you next time. My name is Maya Hayakawa. Goodbye.